Hey 5202, welcome to our final lecture video. This week we're talking about feedback and debriefing, although we're going to be talking a little more about feedback and the assessment process in general rather than debriefing. This is because our simulation group did such a good job of covering it in their module, and I don't want to repeat what they've already been over. But we will be touching on some topics that also apply to debriefing. So let's start things off by traveling back to Module 3, where we talked about planning for teaching. So one of the things we discussed in this module was how different domains of learning or knowledge will impact our teaching strategies and our assessment methods that we use. So just like we can't use the same teaching strategy that we really like for everything, we also can't use the same assessment method for everything. And we also want to make sure we're having that consistency between our learning objectives and our teaching strategy and our assessment method. So as you may remember, there are two parts to the learning objective: the noun or the content and the verb. These represent the knowledge dimension and the cognitive process dimension, respectively. So you want to ask yourself, what kind of knowledge are you assessing? Is it factual, conceptual, procedural, or metacognitive knowledge? And what kinds of cognitive processes were you asking of your students here? Was it to remember, understand, analyze, evaluate, or create? So let's say our learning objective is we want our students to demonstrate how to give an injection. Here we're talking about procedural knowledge, and we're talking about the application of this knowledge. So say having an assessment method like a multiple choice quiz would make absolutely no sense here. And that's not to say that quizzes are bad, it just doesn't match up with our learning objective. If my learning objective had been for students to remember all the steps of properly giving an injection, perhaps then a quiz would be appropriate. Now there are a number of different types of assessment methods and tools that you can use. Two types of assessment that you'll see probably pretty commonly amongst the literature is formative assessment and summative assessment. Formative assessment is meant to help guide our learners towards meeting their learning objectives. So feedback here should be an exchange of information with our learners with the intent of supporting their development. And summative assessment is meant to ensure that our learners are finishing the course with all the required knowledge. And there are a number of different methods here that you can use to assess students' knowledge and their skills. To assess students' knowledge, you could use quizzes and practice tests, written assignments, case studies or scenarios, project reports, essays, and you can also use exams such as written exams, structured practical exams, and oral exams. And for assessing skills, some of the tools you may choose to use include direct observation of students as they perform skills, structured feedback reports on students' performance, or logbooks, learning journals, and care plans. Now, these aren't exhaustive lists, but if you want to learn more about these different assessment tools within HPE, Effective Teaching, a Guide for Educating Healthcare Providers provides a nice, concise overview and some practical tips for you. And now that we've touched on assessment, we can move into actually giving feedback to our students. And it's important to note here that feedback shouldn't be about us as educators imparting our infallible wisdom onto our students. In giving feedback, we want to empower our learners and guide them in finding a path forward in their learning and knowing. So this should be based on trust and respect. And the relationship between you and your learners will become more collegial, so you're kind of teammates in their learning. And part of this is understanding what your learners' goals are. So for example, in my BEd class last semester, I had some students that just really wanted to hit the pavement and start teaching, and they were really looking forward to having a long career teaching, say for example, high school science. Whereas I had other students in my BEd class who were already looking into the master's program and were kind of more interested in adult education and maybe eventually teaching in the BEd program themselves. So this really changed the way I gave both of these different groups feedback. So for example, my prospective science teachers who were just really looking forward to their professional career, I would give them more questions about getting them to question the curriculum and getting them to think about how they could practically apply things in the classroom. Whereas my students that were already looking into graduate studies, I would pose more questions about adult education, or I would pose them some more philosophical questions. And this sort of approach is consistent with adult learning theory. And now granted, this sort of approach can be really difficult if you have a really large class. I've been really fortunate in that the past few years at least, most of my classes have been around 40 people, which makes it a little bit easier for me to build that rapport and get to know my students. So I genuinely have a fairly good idea of what their goals and what their interests are. But one of the ways I find that helps doing this is keeping kind of a spreadsheet where I'll have information about my students. So for example, their name, their professional background, if they have a preferred name that they go by rather than the list that the university sends me. And this is where doing a pre-assessment or survey like I did for this course can really come in handy because you can get to know a lot about your students very quickly. Now, before you even get into giving your students feedback, you need to communicate what your expectations are of them. So make sure your assignments are really clearly explained. I like to make sure my students have a copy of whatever tool I'm going to be using to assess them. So for example, if I have a rubric or a checklist, I want to make sure I communicate that with my class so they know exactly what I'm expecting. And also make sure that your students know about important policies like your late assignment policy, attendance policies, things like that. And while I'm grading, I like to keep track of common mistakes and themes that I'm finding. So for example, last semester with my B-Eds, I kept track of all the common APA mistakes and issues I was seeing. And then we had a class where we went over these common mistakes and I showed them how to fix them all properly. And this can save you a lot of time as an educator when you're marking, because then you're not constantly repeating the exact same feedback. So how do we actually give feedback beyond using these sorts of tools like rubrics? Like, how do we give written feedback? How do we have these verbal conversations with our students? Well, Seymour Walsh talks about the proverbial feedback sandwich, or the feedback burger as I like to call it, because I think burgers are more delicious than sandwiches. The chapter explains that it starts off with something nice, then something they need to improve on, and then ends on something nice again. And Seymour Walsh compares it to a lollipop after an immunization. So the critique is sandwiched between two nice things. Now, a problem here is that sometimes the first and final comment can be a bit tokenistic or kind of superficial, and then sometimes students just ignore these positive comments and they just focus on what they see as being the negative in the middle. However, I do think there is value here in pointing out these nice things for our students. I do like to tell students what they did well, and as a learner, I like to know what I did well because it reinforces my learning for me. So to me, it's not just filler or a bun to sandwich the critique. Now, maybe that's a bit educator-centric of me, but I do think it's important telling students what they did well when we're guiding them along their educational journey. Now, there are other formats that you can use to give your students feedback. Our reading gives the example of Pendleton's rules to engage learners in reflection and discussion. It consists of the educator asking the learner what went well, the educator sharing what they think went well, the educator asking the learner what could be improved on, and the educator sharing what they think could be improved on. Now, I do really like this model, but it's not always feasible. For example, in this class, it wouldn't be reasonable for me to try and reach out to all 35 of you and follow this kind of format, because I would never get any sleep. But I do think in something like more of a preceptorship or being a clinical instructor, I think a model like this could be really, really useful. You may also choose to share an observation with a student and then seek their perspective on it. And Dr. Posner also talks about this in his rant video about simulation debriefs. And both our foundational reading and Dr. Posner stress the importance of this really being a genuine curiosity on your part as the educator. For example, staying curious about why someone's performance was sucky, as Dr. Posner calls it, can really lead you to a new understanding of what was really going on. Because there could actually be a very good reason for what happened. In Dr. Posner's example, the underlying issue wasn't actually about clinical knowledge, it was an issue of communication. And there could be many reasons why our learners' performance was less than ideal, and our reading gives a really good example of this with regards to paramedic students. So in the reading, they give 3 examples of paramedic students where their performance was seen to be lacking confidence. However, as we learn more about these students, we find out that the first one was just really trying to be intentional with the kind of language he used with his patients. The second had recently found out that her husband had bowel cancer, I believe it was, and the third one was recently bullied by someone who was supposed to be a mentor, so was very, very fearful of sharing her opinions. So in giving feedback, we want to make sure we're non-judgmental rather than judgmental. We also want to make sure we're setting an appropriate tone, and we want to make sure our students feel safe and respected. So we really want to set the stage for sharing understandings rather than putting our students on the defense. Because learning is actually impaired by stress and fear, having our students in a constant state of fight or flight is not going to help them learn. So while our job as educators isn't to, metaphorically wrap our students up in bubble wrap, we do want to make sure that we're not putting them in fear of feedback by humiliation or shame-based learning, as we called it when I took 5202. And a good way to help students overcome this fear is to give them feedback regularly, not just when there's been some sort of an incident or they've made a mistake. And also try and reinforce what they've done well. And we're going to end this video with a little vignette about feedback. And this scenario was taken from Teaching 101 by Fisher, 2014. It's evening on call in the emergency department. A very flustered and obviously busy senior resident comes down to review the case with you and the student. The senior asks the medical student to provide a summary of this patient who has septic arthritis of the right knee. At this point, the senior resident briefly asks some questions of the patient, examines the knee, and then you all step outside of the room. Senior resident says, "I'd like to give you a little feedback on your summary." "Okay," the student said. "Your summary was all right, but I'm a bit concerned about your reasoning skills." And the student appears a bit taken aback. The senior resident continues, "You left out the fact that the person has obvious underlying rheumatoid arthritis, and you didn't link that story with your conclusions very well. For example, you didn't mention any details about the results of the aspiration they did when the patient arrived. Making summaries is useful for developing clinical reasoning skills. Also, you didn't mention anything about management, although, in retrospect, given your summary, we would have to discuss it differently anyways. It's important for you to learn how to take ownership of patients, and part of this is making diagnosis and reasonably detailed management plans. I know it's a lot of work, but if you aren't interested in doing this, then it really limits what we can do together, okay?" The student quietly responds, "Okay." The senior resident responds, "Well, anyway, I suggest we move on, as there are 2 new people the emergency doc has asked us to see. Look, generally you're doing very well, but I think you really need to work on your summary skills, okay?" "All right," the student says. So take a moment to reflect on this scenario. How do you think the student felt in this exchange? How would you rate the quality of this feedback? Do you think it was good, satisfactory, unsatisfactory? How could the feedback have been improved? And that's all for now, folks. Since there's no online activity this week, I guess I won't be seeing you all online in the discussion boards, but do feel free to email me if you have any questions. And try to take some time individually this week to just reflect on the reflection questions that I posted on Brightspace. So stay safe, but be kind to others from a safe distance, and take good care of yourselves. Bye!